today, we primarily treat postoperative leakages, and these leakages, they can be in the thorax. So, for instance, after thoracic surgery, esophageal resection, lung lobe resections, etc. Well, sometimes these surgeries might be associated with a postoperative chylothorax, and therefore the lymphatic interventions are very effective to treat this postoperative complication. And the same can be said for a lot of abdominal surgical interventions, which might be associated with chylous or a postoperative lymphocyl. And also for these postoperative abdominal complications, we have now the tools to treat this by interventional radiology. From a historical point of view, the pedal access was the only access we had for lymphatic interventions. However, today we have not only the pedal access, but we have also the intranodal access, which typically is performed from the groin. But we have also now the transhepatic access, which we use for the treatment of protein-losing enteropathy. And last, we can do also direct transabdominal punctures into, for instance, the thoracic duct or the cisterna chyli to treat these, for instance, leakages in the thorax. In addition, before we had only the X-ray based lymphangiography, but today we can do also MR lymphangiography, and that means that we have already much more information before we start the X-ray based in lymphatic intervention. Well, unfortunately, today, in only a few of these IR centers, and these lymphatic interventions, they are performed on a regular basis. And as an example, for instance, in Belgium, well, less than 5 centers perform these lymphatic interventions on a regular basis. We need evidence, and evidence means that we need data from multi-center studies, not only to demonstrate or to show us the safety and the feasibility of the procedure, but also to show us the long-term efficacy of these interventions. Lymphatic interventions, they are becoming more and more important for the IR community because we can now treat more and more diseases and more patients through these lymphatic interventions.